today, the medical guidelines from the European Association of Urology,
Yeah.
and this really interesting deep dive into male infertility from Stat Pearls. So we're going to try to unpack these, pull out the key insights, and give you, the listener, a clearer picture of what male infertility actually is, what causes it,
Right.
and what can be done about it.
Sounds good. It's a fascinating area and one that's so often misunderstood. I think you'll be surprised by, how much we've learned,
Okay.
but also how much we're still discovering about male infertility.
I'm ready to be surprised. But first, let's start with some definitions. When we talk about infertility, how do medical professionals actually define it?
Well, the standard definition is the inability of a couple to conceive after 12 months of regular unprotected sex.
Oh, okay.
And I think it's important to emphasize here that it's about the couple. It's about their ability to conceive, not just in individuals.
That makes sense. It's a shared experience, not just one person's issue. And if in that definition, I noticed that the sources mention primary and secondary infertility.
Right.
What's the distinction there?
So primary infertility means the couple has never been able to conceive at all.
Okay.
Secondary infertility, on the other hand, means they have conceived before, but are now having difficulty.
Oh, I see. So secondary infertility could be due to changes in either partner's health or circumstances since that previous pregnancy.
Exactly. It adds, another layer of complexity to the diagnostic process.
Right, right. Speaking of complexity, I was really intrigued by the term idiopathic infertility.
Yeah.
What does that mean and how common is it?
Idiopathic basically means we don't know the cause. It used to be kind of a catch-all category for cases where no clear cause can be identified.
Yeah.
And it was thought to affect like 30 to 40% of couples with male infertility. However, as our understanding of, male reproductive health has evolved, we're actually finding explanations for more and more of these cases.
Oh, interesting.
Linking them to things like environmental pollutants, or maybe subtle genetic abnormalities, or even just a combination of, smaller issues that kind of add up.
So it's like a medical mystery where we're constantly finding new clues and piecing together a more complete picture.
Precisely.
Yeah.
And it just highlights how much we're still learning,
Right.
about male infertility.
Okay. Before we dive into all those clues and get into the nitty-gritty, let's talk about the scope of this issue. Just how common is male infertility?
It's much more common than a lot of people realize, actually. Male factor infertility is a factor in about 50% of all infertility cases.
Wow.
And in about 20% of cases, it's the sole cause.
Okay.
So global prevalence estimates vary a little bit, but it's clear that this is a significant issue,
Yeah.
affecting millions of couples worldwide.
Those numbers are much higher than I would have expected.
Yeah, it's definitely not a niche issue. And what's, even more fascinating is the variety of potential causes. The EAU guidelines list a whole bunch, ranging from congenital conditions like, undescended testicles, to acquired issues like blockages or injuries, to the reproductive tract.
It's like a detective story,
Yeah.
trying to track down the root cause.
It really is. And sometimes it's not, just one single factor. It could be a combination of things like lifestyle choices, environmental exposures, hormonal imbalances,
Right.
genetic predispositions, even certain medications. All of these can play a role.
It sounds like there's a lot to untangle. Let's try to break it down a bit, starting with those acquired causes you mentioned.
Okay.
What are some of the most common acquired issues that can lead to male infertility?
Well, one that's surprisingly common is varicoceles.
Varicoceles.
Yeah. They're enlarged veins in the scrotum. Think of it like varicose veins,
Right.
but in a very delicate area.
Right. Delicate indeed.
These can disrupt blood flow and increase the temperature around the testicles, which can, in turn, affect sperm production.
The Stat Pearls article actually mentioned varicoceles as a correctable cause of infertility. So there's hope there.
Absolutely. In many cases, surgical repair can significantly improve sperm parameters and increase the chances of conception.
Oh, that's good to know. Aside from varicoceles, what are some other acquired issues that can cause problems?
Well, blockages in the reproductive tract are another common issue.
Blockages.
Yeah. These can be caused by previous infections, injuries, or even surgeries. Imagine a kink in a garden hose. If the sperm can't get through, fertilization can't occur.
That's a great analogy. What about congenital conditions? What are some examples of those?
Well, one of the most common congenital causes is undescended testicles,
Oh, yeah.
also known as cryptorchidism. This is where one or both testicles fail to descend into the scrotum during fetal development. It's like they didn't quite make it to their final destination.
I see why that would be a problem. The
Yeah.
testicles need to be in the scrotum to maintain that right temperature for sperm production.
Exactly. And the location of the undescended testicle actually matters too.
Oh, really?
Yeah, it can be in the inguinal canal, the abdominal cavity, or even what we call an ectopic location, which is basically like somewhere it shouldn't be at all.
Right, right. The EAU guidelines mention that cryptorchidism might be part of something called testicular dysgenesis syndrome.
Yeah.
What is that exactly?
Think of it like a domino effect.
Yeah.
Disruptions during fetal development can lead to this cascade of issues,
Oh, wow.
including cryptorchidism, hypospadias, which is an abnormality, the opening of the urethra,
Okay.
hormonal imbalances, and then an increased risk of things like infertility and even testicular cancer later in life.
So it's a serious condition with potential long-term consequences.
Yes,
Does that mean that early intervention is crucial?
absolutely. Surgical repair, typically an orchidopexy, is usually recommended before the age of 1. The longer a testicle remains undescended, the greater the risk of damage to those developing sperm-producing cells.
The Stat Pearls article mentioned that the germ cell density in the cryptorchid testicle starts to decrease even before 1 year of age,
Yeah.
and that there's generally no sperm production at all in untreated abdominal testicles after puberty.
Right, that's why timing is so critical with this. Early orchidopexy gives the testicle the best chance of functioning properly.
It's amazing how much can happen during those early years of development. It really highlights how vulnerable that developing male reproductive system is.
Absolutely. Now, moving on to another important factor to consider, are hormonal imbalances.
Hormonal issues. What kinds of hormonal problems can affect male fertility?
Well, there are a number of different hormonal imbalances that can come into play. For example, problems with the pituitary gland, which is like the master control center for hormones, can lead to low levels of follicle-stimulating hormone, FSH, and luteinizing hormone, LH.
Right.
And these hormones are essential for sperm production and testosterone production, respectively.
So if a man has low levels of these hormones, that could directly impact his ability to father children.
Exactly. And then there's hyperprolactinemia, which is a condition characterized by high levels of the hormone prolactin.
Okay.
And that can interfere with the normal functioning of the testicles and ultimately suppress sperm production.
It's like a delicate hormonal dance.
Yeah,
And if one partner is out of step, it throws off the whole routine.
that's a great way to put it. And we also can't forget about genetics.
Right. The EAU guidelines mention a number of genetic factors that can play a role in male infertility.
Yeah, things like chromosomal abnormalities, like Klinefelter syndrome, where a man has an extra X chromosome, can lead to impaired testicular function and reduced sperm production. And then there are gene mutations, like those associated with cystic fibrosis that can affect the development and function of the reproductive system.
So it seems like genetics can be a really significant piece of the puzzle.
It definitely can. And then, of course, there's a whole area of lifestyle and environmental factors. This is a particularly fascinating and honestly somewhat concerning aspect of male infertility.
What kinds of lifestyle and environmental factors are we talking about here?
Well, things like smoking, excessive alcohol consumption, drug use, exposure to toxins and radiation, all of these can have a negative impact on sperm, both in terms of quality and quantity.
I've even heard that things like stress and lack of sleep can affect fertility.
Oh, absolutely. Stress can disrupt hormonal balance.
Yeah.
And sleep deprivation can also have negative effects on testosterone levels and sperm production.
It really highlights how interconnected our overall health and well-being are with our reproductive health.
Exactly. And the EAU guidelines even mention a concept called testicular dysgenesis syndrome. It essentially links multiple factors, including environmental exposures during prenatal development, to impaired testicular development and function later in life.
So it's not just about a man's current lifestyle choices, but also about potential exposures during his development in the womb.
That's right. It really underscores the vulnerability of that developing male reproductive system.
Right.
And the potential long-term consequences of those early exposures.
Okay, so we've touched on a huge range of potential causes here, everything from genetics and hormones to lifestyle choices and environmental factors. But how do doctors actually go about diagnosing male infertility? What are the steps involved?
Well, the first step is usually a thorough medical history
Okay.
and a physical exam. The doctor will ask you about your medical history, lifestyle habits, any previous fertility issues. They'll also do a physical exam, paying particular attention to the genitals, looking for any signs of abnormalities.
That makes sense. What happens next? What are the key tests or procedures involved in the diagnostic process?
The cornerstone of diagnosing male infertility is the semen analysis.
Ah, yes, the infamous semen analysis. What exactly does that entail?
Basically, it's a lab test that examines various aspects of a man's semen,
Okay.
including the volume, the sperm count, motility, which is how well the sperm move,
Right.
morphology, or the shape of the sperm,
Okay.
and other factors. It's like a quality control check for sperm.
So it's not just about how much semen a man produces, but also about the health and functionality of the sperm themselves.
Exactly. And there are established reference values for each of these parameters, which helps doctors determine if the results are within a normal range.
What happens if the semen analysis raises some red flags? Where do doctors go from there?
That's when further investigation is needed. And often this includes hormonal evaluation, checking levels of testosterone, FSH, LH, and prolactin.
Okay.
These tests give doctors a window into how well the endocrine system is functioning
Mm-hmm.
and whether there are any hormonal imbalances that could be contributing to the infertility.
The Stat Pearls article also mentioned genetic testing as part of the diagnostic process.
Yes, genetic testing can be really helpful in uncovering hidden predispositions for infertility. It can also assess potential risks to offspring if conception does occur.
That's important information for couples to have.
Absolutely. And then there's imaging. A scrotal ultrasound can be used to assess the size and structure of the testicles and check for any potential issues like varicoceles or those microcalcifications we talked about earlier.
Oh, right. The microcalcifications. Remind me what those are again.
They're basically tiny calcium deposits in the testicles,
Okay.
often so small they can only be seen on an ultrasound.
Are they dangerous?
They're not cancerous themselves,
Okay.
but they can be a marker for an increased risk of testicular cancer, particularly in men who also have other risk factors like infertility or a history of undescended testicles.
So it's something to be aware of.
Exactly. And if those initial tests aren't enough to pinpoint the cause, there are even more specialized tests that examine sperm function in more detail, looking for things like DNA fragmentation and the presence of antibodies that might be attacking the sperm.
It's amazing how much we can learn about sperm these days.
It really is. Technology has come a long way in helping us understand the complexities of male infertility.
So let's say a diagnosis has been made. What are the treatment options available? What can be done to help men overcome these challenges and actually achieve their dream of fatherhood?
Well, that's where things get really interesting. And that's a discussion for our next segment. But before we dive into treatment options, what are your initial thoughts on everything we discussed so far?
Honestly, I'm just blown away by the sheer number of potential causes. It's not just one thing. It's this whole intricate web of factors. And the fact that, environmental exposures during fetal development can have such a long-lasting impact, that's really eye-opening to me. But I'm also really curious to learn more about the treatment options.
Yeah.
What can actually be done to help men overcome these challenges?
That's a great question, and one we'll definitely delve into next. The good news is that there's hope, and there are often multiple paths to explore.
Okay, so we've laid the groundwork. We've explored this whole landscape of potential causes of male infertility.
It's a lot to take in.
It is. It's like a medical mystery with a whole cast of characters.
Right.
But now let's talk about solutions. What can be done to solve these cases and help men achieve their dream of fatherhood?
Yeah, the good news is there's often a path forward.
Oh, okay.
The key is figuring out which path is right for each guy. Because as we've seen, the causes can be so varied.
Right.
It's not a one-size-fits-all situation.
That makes sense. So where do you typically start when you're working with a patient? What are the first things you consider?
Well, before jumping into, complex treatments, I always look at the modifiable lifestyle factors first. It's amazing how much of an impact these can have.
You're talking about things like quitting smoking, cutting back on alcohol, improving diet and exercise, that sort of thing.
Exactly. Those are the big ones. These lifestyle changes can sometimes be enough to significantly improve sperm quality and quantity.
Really?
Yeah. And, it's empowering for patients to feel like they have some control over the situation. It's not all out of their hands.
The Stat Pearls article even mentioned that sometimes, even with a diagnosis of infertility, couples conceive naturally after making these kinds of changes.
It happens more often than you might think. Sometimes simply optimizing a man's overall health can be enough to tip the scales in favor of conception.
That's really encouraging. But what about cases where lifestyle changes alone aren't enough? What other options are on the table?
Well, that's when we start exploring medical interventions.
Okay.
And the specific approach really depends on the underlying cause. So, for instance, if we're dealing with a hormonal imbalance, hormonal therapy can be very effective.
Oh, okay. We talked earlier about how low levels of FSH and LH can impact sperm production. So can hormonal therapy actually boost those hormone levels?
Absolutely. There are medications that can actually stimulate the production of those key hormones, essentially giving the testes a jump start.
I remember the EAU guidelines making a distinction between hypogonadism that develops before puberty versus after puberty. Why is that distinction important when considering hormonal therapy?
It all comes down to tailoring the treatment to the individual situation, right?
Right.
So if the hypogonadism is due to a deficiency in gonadotropin-releasing hormone, or GnRH, which typically occurs before puberty, the treatment often involves a combination of FSH and HCG. That's human chorionic gonadotropin.
HCG. Okay.
Yeah.
What makes HCG so special in these cases?
Well, think of it like this. HCG essentially mimics the effects of luteinizing hormone, or LH,
Okay.
which is crucial for testosterone production. So in cases where LH is lacking, HCG can step in and fill that role.
Ah, so it's like a stand-in for a missing player on the hormonal team?
Exactly. Now, for hypogonadism that develops after puberty, the approach is a bit different.
Oh, okay.
We often start with HCG alone to stimulate testosterone production. And then we can add FSH if needed to specifically boost sperm production.
I see. So it's a stepwise approach, starting with the most appropriate hormone and then adjusting based on the individual's response.
You got it. It's all about finding the right balance of hormones to optimize both testosterone levels and sperm production.
Right.
It's like fine-tuning an engine to get the best performance.
I like that analogy.
Yeah.
What about cases where a man has high prolactin levels or hyperprolactinemia? We talked earlier about how that can interfere with sperm production. What can be done in those situations?
Those are interesting cases because you're essentially tackling the root cause of the problem, not just masking the symptoms. In those situations, we use medications called dopamine agonists, which work by lowering prolactin levels. This allows the testes to function normally again and resume sperm production.
It's fascinating how interconnected the hormonal system is. It's like a delicate dance, and if one partner is out of step, it throws off the whole routine.
I love that analogy. And it really highlights the importance of understanding the whole picture
Yeah.
when it comes to male infertility. You know, it's rarely as simple as just looking at sperm count.
Right. So far, we've talked about lifestyle changes and hormonal therapies. What about surgical interventions? When do those come into play?
Surgical interventions are usually reserved for cases where there's a physical obstruction
Okay.
or anatomical issue that's preventing sperm from being produced or transported properly. We already discussed varicocelectomy, which is the surgical repair of varicoceles, but there are other procedures as well.
I remember the EAU guidelines mentioning surgical options for both obstructive azoospermia and non-obstructive azoospermia.
Right.
What's the difference between those two again?
Obstructive azoospermia means there's a blockage somewhere in the reproductive tract that's preventing the sperm from getting out. Imagine a kink in a garden hose.
Okay.
You know, the water's there, but it can't flow freely.
That's a great visual. So in those cases, the goal of surgery is to clear the blockage.
Exactly. There are a few different procedures that can be used depending on the location and the nature of the blockage. For example, a vasovasostomy is a procedure where a severed vas deferens, which is the tube that carries sperm from the epididymis to the urethra, is reconnected.
Oh, okay. So it's like reattaching the two ends of that garden hose you mentioned.
Precisely. And then there's epididymovasostomy, which is used to bypass a blockage in the epididymis,
Yeah.
which is this coiled tube that sits on top of the testicle and stores sperm.
Got it. And what about non-obstructive azoospermia?
Yeah.
In those cases, the problem isn't a blockage, but rather an issue with sperm production itself. Is that right?
Right. And that's where sperm retrieval techniques come in.
Okay.
These are procedures that allow doctors to extract sperm directly from the testicles or the epididymis. They can be incredibly helpful for men who have very low sperm counts or even no sperm in their ejaculate.
I'm thinking of those acronyms we touched on earlier, TEAS, MESA, and PISA. Can you remind me what those stand for and explain a bit more about how they work?
Of course. TC stands for testicular sperm extraction.
Okay.
MESA stands for microsurgical epididymal sperm aspiration.
Okay.
And PISA stands for percutaneous epididymal sperm aspiration.
Got it. So if traditional semen analysis doesn't show any sperm, these techniques offer a way to search more thoroughly.
Exactly. Imagine TEAS is like a microscopic treasure hunt.
Okay.
Doctors are using fine needles and microscopes to carefully search for those precious sperm cells within the testicle itself.
That's incredible. And MESA and PISA are similar, but they target the epididymis instead of the testicle.
You got it. MESA is a bit more delicate and involves using a microscope to carefully aspirate sperm from the epididymis. PISA is a less invasive technique where a needle is inserted through the skin to collect sperm from the epididymis.
So these techniques can give men with even severe infertility a fighting chance at becoming fathers.
That's the goal. Once the sperm are retrieved, they could be used for assisted reproductive technologies, or ARTI, like in vitro fertilization, or IVF, with intracytoplasmic sperm injection, or ICSI.
Okay, we touched on IVF and ICSI briefly earlier, but can you explain a bit more about what those procedures involve?
Sure. With IVF, fertilization happens outside the body in a laboratory setting.
Okay.
The woman's eggs are retrieved, and then they're combined with the man's sperm in a petri dish. If fertilization occurs, the resulting embryos are then transferred back into the woman's uterus.
So it's like bypassing the normal process of fertilization that happens in the fallopian tubes.
Precisely. Now, ICSI is often used in conjunction with IVF,
Okay.
especially when there are male factor infertility issues. It involves injecting a single sperm directly into an egg in the laboratory. It's like giving the sperm a little extra help in achieving fertilization.
Wow, it's amazing how these technologies can overcome so many obstacles to conception.
It really is a testament to how far reproductive medicine has come. But I think it's important to remember that technology is only part of the equation.
What do you mean?
Well, while these advancements are incredible, it's crucial to acknowledge that the journey through infertility can be incredibly emotionally challenging.
Oh, absolutely. It's easy to get caught up in the science and the medical aspects of it all, but we can't forget about the human element.
Exactly. It's important to remember that there are real people behind these diagnoses,
Yeah.
and their feelings and experiences matter.
Yeah.
The EAU guidelines actually emphasize the importance of providing psychological support
Right?
throughout the infertility journey.
That makes a lot of sense. What kinds of emotional challenges do couples typically face when they're dealing with infertility?
Well, it can be a real roller coaster.
Yeah.
Feelings of sadness, anger, frustration, guilt, even grief are all very common.
Yeah.
And the stress of treatments, the financial burden, the uncertainty of outcomes,
Right.
all of that can take a huge toll on both partners.
It sounds incredibly overwhelming. What kind of support is available for couples going through this?
There are a lot of resources available, and I encourage couples to take advantage of them. Counseling can be incredibly helpful,
Okay.
both individually and as a couple. There are also support groups where people can connect with others who are going through similar experiences. And sometimes just being able to talk openly with friends and family can make a big difference.
It's about having a safe space to process those emotions and feel supported.
Exactly. It's also important for couples to remember that they're not alone in this. Male infertility is more common than many people realize. And there are millions of couples around the world who are facing these challenges.
We've covered an incredible amount of ground in this deep dive into male infertility. It's clear that this is a complex and multifaceted issue, but it's also clear that there's hope. With the right diagnosis, treatment, and support, many men can overcome infertility and fulfill their dream of becoming fathers.
That's a great way to sum it up. And as research continues to advance, we're only going to see more and more options becoming available.
That's really encouraging. But before we wrap up, I want to circle back to that question you raised earlier about environmental factors and their impact on male reproductive health. It seems like that's an area that deserves further exploration.
It absolutely does. What we're seeing in research is a clear link between certain environmental exposures and declining sperm counts and quality.
What are some of the most concerning environmental factors? What are some of the most concerning environmental factors?
Well, exposure to endocrine-disrupting chemicals is a huge area of concern. These chemicals are, they can mimic or block hormones in the body, throwing off that delicate hormonal balance we talked about.
And these endocrine disruptors are pretty common in everyday life, right?
Yeah, unfortunately they are. We're talking about things like pesticides, plasticizers found in plastics, certain personal care products, even some industrial chemicals. They can be in our food, our water, the air we breathe, the products we use.
So it sounds like they're pretty hard to avoid completely. Is there anything individuals can do to at least minimize their exposure to these chemicals?
Absolutely. Awareness is the first step. Reading labels carefully. choosing organic foods when possible, filtering your water, avoiding plastic containers, especially when you're heating food. All of these things can help. Even small changes can make a difference.
Those are some great practical tips. What about on a larger scale, though? What can be done to address this issue from a, societal or public health perspective?
Well, we need stricter regulations on the use of these harmful chemicals. That's where advocacy and policy changes come in, supporting organizations that are working to protect environmental health and promoting sustainable practices. These are all crucial steps.
It's about thinking beyond ourselves and considering the long-term impact of our choices, not just for our own health, but for the health of future generations as well.
Exactly. It's about creating a healthier and more sustainable world for everyone.
This has been such an eye-opening conversation. We've learned so much about the complexities of male infertility, from the biological mechanisms to the emotional and even societal implications.
It's a topic that definitely deserves more attention and understanding. And hopefully, this deep dive has helped shed some light on it.
I think it definitely has. One of the biggest takeaways for me is that there's hope. With the right diagnosis, the right treatment, the right support, many men can overcome infertility and experience the joy of fatherhood.
I couldn't agree more. And as research continues to advance, we're only going to see more options and better outcomes in the future.
That's incredibly encouraging. Well, thank you so much for sharing your expertise with us today. It's been a true pleasure learning from you.
The pleasure was all mine.
And to you, dear listener, thank you for joining us on this deep dive into the fascinating and sometimes challenging world of male infertility. We hope you found this episode informative and empowering. Remember, knowledge is power, and with the right information and support, you can navigate this journey with confidence and hope. Until next time, take care.